Okay, I apologize for running late for our Facebook Live, and I'm getting texts, so there must be someone watching. But tonight I wanted to make it sort of quick and dirty and just cover a couple easy things to have everybody remind everyone that if you have not seen our previous videos on gut health, we've had a whole bunch of feedback, and I'm so glad. Hi everybody. I'm so glad that they've made an impact, that you feel like you're learning something, that it's beneficial, that you see how your gut health can impact your health overall. I think it's a very important topic, and we covered it in our last few videos, so if you haven't seen it, please do take a look. And obviously most of you know, but I am Dr. Jordan Leasure with North Shore Proactive Health, and please remember that anything that we cover tonight is not meant to be medical advice. It is simply my topics that interest me and my education that I'm trying to provide to you in a quick and easy format. So I just got done signing up another affiliate for our salutogenic lifeline. And if you don't know what that is, take a look at the website. It's salutogeniclife.com, and it's our supplements that I use. So most of the time when I'm doing these and I'm talking about different products, that's obviously what I'm referring to. I've had great success and just had a med spa that's interested in carrying some of the products, so that's where I was, and that's why I was running late, so I apologize again. But I'm glad that you guys hung in there and were interested in what we had to say tonight. So some of what we talked about, which was, yes, Jim, I love it. Some of what we talked about tonight that actually they found interesting, and it was super cool because their nurses, one of them had been an oncology nurse, was how PCOS is actually impacted by your gut health. And for those of you that don't know, Polycystic Ovarian Syndrome is pretty prevalent. It's in about 20% of women and can impact your fertility, can impact your ability to have multiple successful pregnancies. It actually can also impact, and it plays a role in weight loss as well as other inflammatory processes. So, you know, it's something that's super important, and again, plays back to one of our favorite topics, which is gut health. So I was discussing with the nurses, and they, again, were totally unaware that there was a connection there. And we sort of laid out the functional medicine approach to PCOS. And what I do with clients, and please don't be offended, but you know, the ideal way that we should be coming into this world is that our mother is happy, healthy, and energetic, and has a very safe and successful, wonderful, easy, quote unquote, pregnancy. And then when it's time for you to be born, you or your current children or your future children, ideally they are born vaginally. And the reason for that is because there's a neurological impulse on the baby when they are forced through the birth canal. And then when they are born vaginally, they're exposed to specific bacteria on the mom. And then they are put on, ideally, on the mom's stomach. So they're exposed to the bacteria that lives on the mom's skin. And then again, ideally, they're breastfed. And that breast milk is specifically designed based on the baby's saliva to impact and to feed, hi Fumi, to feed the baby's bacteria that it was just exposed to. And that is, again, the ideal scenario. And it doesn't happen that perfectly for all of us. And it didn't happen that perfectly for myself. And imagine how amazing I would be had I been born ideally. Thanks, Jan. You gave it a good try there. But, you know, if those circumstances are not followed to a T, then the organization of the bacteria in the gut of that baby, and then, you know, that baby's obviously currently us, is not going to be ideal. So what do we do about that, and what can that lead to are the two questions that we see most often. So what can it lead to? It can lead to a variety of things. We hit on a handful of them the last couple weeks. Anxiety, depression, and obviously currently PCOS. So please make sure that you're paying attention to, your health history prior to your current acute episode. When someone goes to their primary care physician, you go for a specific complaint, you're worried about pain you're having, you're worried about, let's stay on the PCOS topic. It could be infertility. And a lot of times, your complaint is very zeroed in, and that's all that you're concerned about. And we sort of have blinders on to everything else that has happened. But from a functional medicine standpoint, things as minute as how you were born, or how long you were breastfed, or if you were given certain vaccines, all of that plays a role in what your gut health looks like and the symptoms that you're having today. So please make sure that if you're having any of these symptoms, that you're talking with your doctor. And regardless of what the symptom is or what the diagnosis that you're currently dealing with is, make sure they're looking at everything else, because how you were born, what your gut health looks like, toxins that you were exposed to, all of that will play a role in getting you to where you are today. And then what's important and how we use that is sort of backtracking and treating or compensating for some of those previous issues. And that's how we make sure that you are as happy, healthy, and energetic as you can be. Hi, everybody that's signing on. And that's how we address your current concerns. So that's what makes functional medicine a little bit different from seeing an allopathic physician. And again, if you don't have a functional medicine doctor, I'm a big fan of Institute for Functional Medicine. So take a look at ifm.org and you can find a functional medicine practitioner near you. Of course, if you're in the Chicagoland area, we do still have availability for practice members in our office to see me. So please feel free, take a look and see if that's right for you, because you should not be suffering with a disease process and not have an answer and not have a game plan. And if the only game plan is a medication, I have very strong thoughts about this, because I had a young girl come into my office. She was 18 and her dad was mid-30s, and they were both on high blood pressure medication. And I said, okay, well, what's the plan? And they both looked at me like they were crazy. And I thought I would appeal to him as the father, and I said, is your plan for her to be on this medication for the next 70 years? And he looked at me sort of dumbfounded. And his answer was, yeah, I guess it is. And his doctor had never discussed with them lifestyle modifications or the things that needed to be done. So number one, maybe she would never need the medication in the first place. And number two, she would be able to eventually get off the medication. So that's very scary. So if you do not have a game plan with your physician, a lot of medications were only approved and meant to be used for short-term usage, especially those that are antidepressants or anti-anxiety medications. They were not meant to be used long-term. They were meant to be used for a short, acute episode to help you get over the hump, to help you be functional and do what you need to do so you can maintain that through lifestyle modifications, through diet, through exercise, things like that. So please make sure that you have a game plan with your physician. If you don't, I'm happy to make a couple suggestions and help guide you on this journey of health and wellness. So we touched a little bit on PCOS tonight. I hope that you found it beneficial. It's definitely something that affects more of the population than it needs to. And if we can make some lifestyle modifications, if we can improve our insulin sensitivity, if we can take a look at increasing our fruits and vegetable intake, if we can work on lifestyle modifications that impact our stress, because we can't affect the stress itself, but if we can impact how we're dealing with the stress, and if we can get out there and be active. Not all of us live in somewhere nice and sunny 99% of the time, but, join a gym, get a group together, get outside, go and walk at the mall. There's plenty of places you can go and be active and get a little bit more, do a little activity. And I'm saying this as Kristen's watching, do a little activity at your office. So sign me up tomorrow. We'll see where I have availability in my schedule, and I'll do some activity with Kristen just so that I'm holding true to my word here. If you have any questions, please feel free to contact us at our office at drleasure.com. And again, that's DRLEASURE.com. Because if you go to Dr. Leasure spelled like fun, it's actually in Nude Beach. So there's a 2-for-1 tidbit of information for you tonight. So I hope you found that helpful and beneficial. Please remember, you don't need to be drowning to ask for help, and that goes for emotionally, it goes for physically. If there's anything that we can do, please feel free to reach out. Hi guys. Nice, Jim. Good answer. Jim's gonna go walk his dog, so all of us can get a little bit of activity. So thank you so much. Love you all. Have a happy, healthy Wednesday, and we will see you next week. If there's a topic that you want to hear about, please send me a message. There are so many options, and usually I'm just talking about things that I find interesting or I had a patient ask about that day. But for those of you that take the time to watch, I appreciate it. And if there's anything that I can do to answer, please send us a quick note. We will see you soon. Bye-bye.